The head of the World Health Organization is sending new warnings about the scale and spread of the Ebola outbreak across Congo.
The Ebola outbreak in the Democratic Republic of the Congo is spreading rapidly. There are now almost 750 suspected cases and 177 suspected deaths.
But the WHO says the situation in neighboring Uganda is now stable, with just 2 confirmed cases in people who traveled from Congo. One of them died. The United Nations putting $60 million towards accelerating the response in Congo and across the region. Anna Cunningham, following this outbreak, and Anna, with cases rising, what is the WHO saying about how the risks are playing out?
Well, David, that news conference is still ongoing at the moment. I think the key message that we can take from the World Health Organization is that the Ebola virus is spreading rapidly in the Democratic Republic of Congo. It has now reclassified the risk there in country as very high. Let's take a listen to Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO.
Previously, WHO assessed the risk as high at the national and regional levels and low at global levels. We're now revising our risk assessment to very high at the national level, high at the regional level, and low at global level.
So that reclassification now in place. We know, David, the epicenter remains in Ituri province. It's in the northeast, close to the border with Uganda, but cases now are being picked up elsewhere within the DRC. What is clear is there are big obstacles for the WHO. Patient 0 has not been identified. This Bundibugyo strain has no vaccine. There is also fear and disbelief. The images that you're looking at the moment from a centre where Ebola patients were, and that itself was set on fire. Add into all this as well, of course, the security situation in the DRC, many areas under control of the M23 rebels. David.
And let's talk about that fire. What does the impact mean for what are relatively few treatment facilities for Ebola patients?
Yeah, this is an incredibly difficult situation for the WHO. You know, at the time it's trying to limit the spread of Ebola on the ground, there is this mistrust in people coming into those areas. And this happened as a result of protests. As they said, a local soccer star had died from typhoid, not Ebola. There are many people who just don't believe that it exists. The WHO saying at the moment it's on the ground trying to calm the situation and share information. Let's take a listen to Dr. Anne Ansia. She was on the move when she spoke from the DRC.
Security problem that we faced yesterday in Rwampara will significantly jeopardize the very strong operation and rapid operation that we were initiating in Rwampara, which is one of the 3 hottest spots of the outbreak response for the time being.
Now, she has said that they have located a new hospital site and they're going to start to rebuild and bring those positive Ebola patients there for monitoring and treatment. And as you said, David, the UN has released $60 million in emergency funding to ramp up its response. David.
Anna Cunningham, thank you very much.